So this is a sort of a broad general question, but try to answer to the best you can, because I know each person's variable. But generally speaking, how many grafts can you extract? And I'm talking over the course of even multiple surgeries, if you need to go that route, from the donor area of the average person, while maintaining the integrity of the look of that area and not over harvesting.
It depends on the skill set of your surgeon and the clinic, ultimately. We have about 100,000 follicles that we're born with, 50,000 on top, 50,000 in the donor region. The 50,000 in donor region, on most folks, you can likely take anywhere between 7 to 13, 14,000 follicles without it having the appearance of being over-harvested. And how you use that is the key,
Right.
and that is critical.
Right.
And so an average person on their scalp can have anywhere between 6,000, 7,000, and those whom are blessed up to 13,000, 14,000 that can be extracted with high accuracy, of course. You can't have a high transection rate.
Right.
And not inclusive of body hair. Most patients with a beard similar to yours can safely extract about 1,500 to 2,000 from underneath the chin.
Interesting.
And those that are blessed to have hair on the back and the chest of good quality, of acceptable thickness, those can also be harvested as well, and that number could be limitless. We have had patients who have had north of 14,000, 15,000 follicles who went from class 7 to now full concealment.
Wow, that's impressive.
It took a lot of work and a lot of effort, not only on our part, but on our patient's part, to
Right.
have a goal, to go after it, to research, follow up, be compliant with the post-operative course, which is very stringent for us.
Right.
And to practice an ounce of prevention, which is worth its weight in gold, by doing things that are acceptable, that have minimal risks, such as use of organic products. And it is a pleasure to see those patients after their results.
Fantastic, fantastic. You're known, your clinic is known particularly for your hairline work, or the work that you do in the sort of frontal forelock region. And a lot of young men and women, obviously are very sensitive about the frontal region and may not have experienced the full extent of the hair loss that they're going to experience in their lifetime. So given that you do have that frontal sort of, you're known for that, doing good work in that region, how do you mitigate for and plan for the younger people, or just generally anyone who may experience more hair loss in the future, so that they don't end up looking awkward years down the road, where they might look good now, but years down the road, they may lose more hair in the back? How do you plan for that? How do you mitigate for that?
We find the best way to plan for it and or mitigate is educate our patients. Get to know our patients' expectations. We have had a set of identical twins with different expectations of how their hairline should be. For some, the crown may not be important. For some, it is extremely important. All of those things matter because, again, the number of donor tissue that we have, the number of follicles, for most patients is finite, and we need to make good use of it. So you plan with the patient, and the most important thing that I think every patient should know, and you've done a great job on your site, is to let folks know that hair loss is progressive. Hair loss is aging of the follicles. In some people, it begins at the age of 16. In some people, it begins at the age of 66. Catastrophic to both, regardless of age. And you sit down with them and you let them know that this can happen, that the hair restoration is not a one-time procedure for most folks. And you let them know what that future can hold, and if that look is acceptable for them. And I've been surprised when you collaborate with the patient, when you allow the patient to be an active caretaker, then your work becomes much easier because now you're at their service in what they're looking to achieve. For some, the crown may not be important, and you let them know they have 6,000 grafts, and they say, "Doc, I want my facial framing, I want the mid-scalp concealment. If the crown is thin, I don't mind." For others, it's extremely important, and you let them know the limitations of what progressive hair loss can be, especially if they don't provide any sort of preventative measures. And so hair loss is progressive. Hair follicles do age. You are, most patients have a finite number of donor area, and you collaborate with patient how to best use those grafts for them. Some may just want hair all over through, and you can go with low density and spread the follicles all throughout so they maintain their look. For others, the facial framing is critical. It's how they perceive themselves. It's how they view themselves. And so you let them know that it's the most graft consuming area of the scalp because it's a process you cannot cheat. The angles have to be correct. The direction has to be perfect. The appropriation of the grafts to specific regions, the temple closure, dense packing, all of these things accumulate in an amazing, awesome result. You shortchange any of those, the result becomes shortchanged. You shortchange the education process and managing patients' expectation, you shortchange the patient.
So, I think you address that, but there's also the issue of the patient who may, in their youth or for whatever reason, just say right now they're not worried about that progression, but then who may realize years later that maybe that wasn't a wise move. You sometimes see people that have had their hairline's brought down too low and it looks unnatural. Do you find that even with that consultation that you ever reject a request of someone who may be over aggressive in there, or do you try to just accommodate them to the best degree you can? Have you ever had to turn anybody down, for instance?
Of course. I mean, listen, my role specifically and the role of a surgeon is to guide a patient and then to service the patient. And so if an unexpected request is made where in your experience you would be doing a disservice to that patient, I think that's just terrible. And so of course you manage expectations. There are plenty of patients, not everyone is a candidate for this procedure, and that's a great point that you bring up. And those that are fortunate enough to have the donor region to be able to do what they are looking to achieve, those you guide. But there are also many patients, unfortunately, with the technology that is available today, yet still we cannot assist and help them, or if we do, the look won't be what they perceive it or hope that it would be. And I think that's also a disservice. And so absolutely, not everyone is a candidate for this procedure. And that's why a lot of research needs to be done prior. This should not be a decision that's made on a whim. A lot of our patients here have spent 2 to 3 years researching, educating themselves, interviewing their prospective surgeons, and then proceeding with. And also, just to get back to preventative measures, those have to be incorporated.
Do you mean like medications?
I mean anything that could help prevent. Every little bit helps.
Right.
And so there are pharmaceutical medications, some with adverse risk that you must take heed before you consume. There are other medications that have very little side effects, like minoxidil, topical, for example. Right. Although it does require daily compliance for it to work, otherwise you will lose more hair. Organic products, removing waste from your life, nutrition-wise. It would be nice if we could eliminate stress, but for now we'll just practice breathing instead.
Right.
And every little bit helps. What we're trying to do is slow down the aging process of the follicles. it's tough to slow down our own aging process. And so for follicular rejuvenation, we must do everything we can to combat, knowing that the surge for hair loss, the drive for hair loss, is not always at the same high revving level all the time. And as we become older and DHT levels suppress and enzymatic levels vary, then the drive for hair loss becomes less and less. And so it's not a simple answer, but everything does help a bit. And if you extrapolate things out, we have 50,000 follicles in someone who otherwise has not lost hair on top of their scalp. Minoxidil generally provides about a 10% benefit. 10% of 50,000 follicles would be 5,000 grafts, which is a procedure that if we do would make my team and myself very tired and fatiguing because it's very long. And it wouldn't involve having a single needle inserted, and it's very minimally invasive. So it's a combination of all of that.